Adam, you're all right? We're going to get started. This is the January 20th meeting for the Health and Human Services Board. I'll call our meeting to order. Colleen, you want to do roll call, please?
Sure, let's give it a minute. Are they recording over there? Do you know, Ken?
Yep, the screen switched, so they should be all set.
I just see it. Okay. Kathy Leaf.
Present.
Kara Koch.
Present.
Dave Osnes.
Present.
Scotty Yard.
Present.
Greg Telejohn.
Present.
Paulette Anderson.
Present.
Deb Lindeman.
Present.
Natasha Ward.
Present.
Paul McGinnis.
Okay, we've got a quorum. So we'll move on to the approval of minutes from December 16th. Are there any additions or corrections? Hearing none, those will stand as written. We'll go into public comment. I'm going to limit public comment tonight to 30 minutes. We've got a lot on our table. Adam, have we got anybody online, or Ken?
Yep, I got it this evening, Chairman Osnes. We do have one person with their hand raised so far.
Okay.
So the first person for public comment will be Kelsey Janetsky.
Hey everybody, can you hear me okay?
We can, go ahead.
Awesome, thanks so much. Kelsey Janetsky, I live at 512 4th Street, Hudson, Wisconsin. I just wanted to pop in and thank everybody for their hard work. Happy New Year. We made it. I know that we've all been through a lot and it's been rough. So I just want you to know that you're appreciated. Things have been tough. And I know that it's been a lot. So that's all I've got for you. Please keep doing the hard work. Please keep trying to keep this virus under control, given everything we have going on in our community. Know that you're appreciated. Thank you.
All right, I have two more, Chairman.
Okay.
So I have Becca that's up next. Go ahead, Becca.
Hi, can you hear me?
Yes, go ahead.
Hi, my name is Becca Hagel. I'm in Hudson. And I just want to acknowledge all the people on this board who have been courageous leaders. You continue to stand for the safety and well-being of the community, even though many of you have been attacked relentlessly by extremists on social media. I'm sure if I did an open records request, I would find that you've also been harassed as well through email. I appreciate those of you who have stood strong through this and continue to push forward and do the right thing during this pandemic.
All right, that looks like that's all for Becca. Thank you. Next up with their hand raised is Virginia Drath.
Can you hear me?
We can. Go ahead, Virginia.
Okay. Good evening. My name is Virginia Drath. I live at 1541 County Road O in Emerald. I would like to thank the Health and Human Service Board for taking manure spills and brown water seriously enough to join with the Community Development Department in preparing and presenting the St. Croix County Manure Spill and Brown Water Event Response Plan. For many, many years, brown water coming from some folks' faucets has been talked about, but not much has been done, if anything, about this problem. Mostly it's been swept under the rug. Maybe we will see much better regulations, which I call protections, in the coming year. This past week at our Town of Emerald monthly meeting, I asked the board what was the nitrate level result from our town hall water sample in November. I was told it was 28 parts per million. We do have a reverse osmosis system at our drinking fountain at the town hall. That is the only faucet that is safe. I do have a question about how quickly can public health respond to citizens if a spill occurs after hours on a Friday night. A spill flowing down the ditch or into a stream can't wait until Monday for public health to be notifying the surrounding citizens. Thank you.
All right, thank you, Virginia. I have one more with their hand raised. If anyone else wants to speak, make sure that you raise the hand in the feature here. Next up is Essentially Free is the name.
Oh, hi, my name is Charlene Stoddard. I am present at the courthouse tonight. So I didn't originally have anything to say, but I have other members here who do have public comment and are having a hard time connecting. Can you hear me?
Yep, we can hear you. So do you have somebody there that wanted to make a comment?
Would you guys? Yes. Hold on one second.
Sorry. This is Jen from Wilson. I was at the administrative committee meeting yesterday, and I just want to say that between more propaganda being promoted in the county and time given to Dr. McGinnis to continue to spread that propaganda, and yet not given to community members who would like to find ways to promote other healthy alternatives. It's really disappointing to spend all this time that we have spent over the last 6 months being here and speaking with you and bringing you proof and more information and all of the things that we've been doing, only to have things being said like, oh, we're sure you're getting harassed on the emails and that kind of crap. And then to hear people like our supervisors want to basically blacklist businesses into complying with recommendations from higher up, which don't even promote health at all. And then to say something like, sorry, I just lost my train of thought. To say something like, you want to give money to businesses and reward them for good behavior. It is appalling that we are going to blacklist people for not making sure that people give up their constitutional right to walk about freely in this county, and we refuse to promote health alternatives and all of that. And you want to pay money to businesses, making sure that people wear a mask. I mean,
It is 2 minutes for you now, Jen. So did you have anyone else there that needed to speak on the phone that wasn't available, able to get on?
I think we have one more.
Okay. So who else do you have if you want to pass the phone to them?
Okay, I guess they're not ready to speak, so
All right.
we'll have to wait.
Okay, I have one more online then. Thank you.
Thank you.
All right, I have one more with their hand raised online. Lynn, you are up next. Are you there, Lynn? Lynn just got unmuted, so I'm waiting for Lynn to speak. I'm not hearing you, Lynn. Is there anybody else that would like to speak during public comment this evening? All right. I do not. Let's see.
Okay, hello.
Oh,
Can you
there
hear
we
me
go. Oh,
Okay.
I was just about to cut you off, Lynn. You're so lucky.
Thank you so much because I haven't
All right, go
prepared.
ahead.
Thank you. It was last month that I announced to this board that Dave Osmus gave citizens permission to hold a listening session, and we got to work. We got one medical doctor, 2 chiropractors, a nutritionist business owner, a mental health professional, a lifestyle coach, and 1 pastor. All of these professionals are willing to sacrifice their time to share their positive experiences, wisdom, and expertise to share with our county citizens. They wanted, however, I found out after it got canceled that the board had wanted more information and outlines from these specialists, which in my mind means that this board wanted to control or micromanage the information, which is a concern to me. This listening session would have been an opportunity for the government to hear health opinions that have thus far been suppressed or at best ignored. Specialists who have had real solutions for building immunity. Please, citizens, be aware. You are not hearing all these cautions about mask wearing, social distancing, and the vaccine. Does it not concern you? These professionals would have given you other information you are not hearing anywhere else. They could have given you practical ideas for improving your health and could have had an impact on our governmental decisions. If you are interested in researching more about the vaccine and other issues, consider checking out a website such as childrenshealthdefense.org. I hope this board will focus on true health, not finding more ways to control citizens with fear, misinformation, and suppression of information and truth. Please allow your citizens to make decisions for their own health, the amount of oxygen they breathe, the chemicals and technologies that enter their bodies, and the people they desperately need to connect with without being made to feel that they are being selfish for wanting these things. Again, that website is childrenshealthdefense.org.
And that's your 2 minutes. Thank you, Lynn. All right, are there any other participants that would like to speak during public comment? Activated Patriot, I saw your hand going up and down. I wasn't sure if you want to speak. If you do, please raise it now. Otherwise, I'm going to pass it back to the chairman. All right. I am not showing any other participants to speak, Chairman Osnes.
Okay, Ken, thank you. We'll move right on into our business items. And the first one is a public health update from Ellie. Ellie, you're on board.
Thank you so much. Just let me get organized here as my camera only appears on one computer and I do all of my work on another computer. So I am loading now to make sure everything is working. All right.
Hi, this is Kelly. This is Kelly Ingen. I just wanted, before Ellie started, to say we are in the midst of a vaccination clinic today, and Ellie is going to be giving the presentation, but she will do a fantastic job, and just wanted to let you know we're underway vaccinating here in Richmond, and things are going good. So thanks for the board for being here. All right, Ellie, thank you so much.
No problem. All right. As Kelly said, I am here as well, being a part of the vaccination, but I'm glad to be here and present to you today. I'm gonna, oh, Ken, could you go ahead and enable screen sharing for me? Great, thank you so much. Okay. All right. So what I have today is just a brief summary again. As we all understand, we are still here at Public Health responding to the COVID-19 pandemic. We in the county have had a total of 7,231 cases in our county. Currently, we have 25% of those that are testing. They are testing positive. We have 9 hospitalizations in our Western Wisconsin hospitals, and those are from Pierce, St. Croix, and Polk counties. And then we do have a total of 38 deaths due to COVID of St. Croix County residents. Okay, what we're seeing currently is we have, what I'd like to focus on here is the green 33. That's our 7-day average, and that's the number we should be looking at always in terms of an equalizer and understanding what kind of the average number is of new cases that are being reported in St. Croix County, of St. Croix County residents testing positive. We're still getting about 33 cases a day, which if we look in terms of where does that take us in the response and the number of cases we've had daily over time, we are definitely dropping in the number of daily new cases. We look to be now where we were here, let me remove these other pieces so we have a better idea of looking just at our 7-day average trend. We are down to about the point we saw ourselves at in the beginning to mid-October. What that does mean is that things are going down from that height of COVID cases in November, but we're not down to any level where we should be feeling comfortable just yet. What I'd like to point out here is if we go back and look at this number 23, we have been oscillating in our county, according to our reported case numbers by day to the county, between an orange risk level and a red list risk level. Once you would click here for more information, that will bring you to the Harvard metrics, which basically says that we predominantly are staying in the red. So we are predominantly still in a period of uncontrolled spread in our county. If you do look at that map, nearly all of Wisconsin, or all of Wisconsin as of now, I believe, is still in a period of uncontrolled spread. So things are not as incredibly out of control as they were, but we're still in uncontrolled spread. Here we can see the difference between our individuals and kind of the steep slope we're seeing here is that great rise in cases. We're seeing the blue being those who are testing by PCR or NATT test, and then the yellow being those that are testing with an antigen test. Okay. If we move on, I wanted to include here, we have our hospitalizations. These are those 9 we talked about in our Western Wisconsin hospitals. Western Wisconsin, the hospitals listed below here, from North and Amory and Osceola and St. Croix Falls, down to Baldwin and Western Wisconsin Health, River Falls, and New Richmond and Hudson. The reason these have recently become unavailable with the data is the bed availability was presented to the county from a consortium of all these Western Wisconsin hospitals who also conversed with the Twin Cities. Due to the just burden of creating this metric every day, the metric has been done away with. And because there is less of a need, we are seeing now below double digits, we're in 9 current patients. So we're seeing less of a need for a bed availability metric. But should those numbers rise, we're going to keep those here and we'll provide those numbers again. Or excuse me, not the numbers, but the metric. So the green, red, or yellow to indicate bed availability if that should pick up and that metric become available again. Okay, moving on to our deaths. We did unfortunately report a new death as of today. So these are COVID-19 deaths of St. Croix County residents, with COVID being a cause or contributing factor to that death by the death certificate. And so we do wait for that death certificate. So some of these deaths maybe have latently been reported in wait of that confirmatory death certificate, or some may be more recent reported. So currently we're at 38, which is lower on terms for a county of our size and proportion, but it is still increasing. Since Monday now we've had an additional 4 deaths. So it is unfortunately a metric that we're still measuring and still adding to. When we look at the age of those deaths, we are seeing them in our older population. Obviously here we have our 90 or greater years of age. They're at 26%. The greatest majority of the deaths have occurred in our 70 to 79 years old with 34%. And then the next being those 80 to 89. Our youngest, we did have a death in a 50 to 59-year-old in St. Croix County. In gender, they are predominantly male, about 75-25, and that does stay true. Okay. As we move on and looking at demographics, this is demographics of all cases. This demographic does mirror that of active cases, those with the active disease. Looking at our average age of someone infected with COVID-19 currently in our county is 39 years old. So, and that is just representative of, we have a large proportion of our cases falling between 20 to 60 years old. Okay. The gender of those who are infected for all time and currently, the gender is about 50-50, with obviously the same ethnicity being the grand majority, not Hispanic or Latino. One thing I did want to touch on tonight is just looking at influenza in Wisconsin. So what you see here is a graph of the influenza-like activity in Wisconsin. We're seeing with our current flu season being the year 2020 to 2021, on that red line below. If you're looking at the x-axis there, the influenza season week, know that that is the week of the year. So, we are still moving on in our weeks of the year, but what we're seeing is a very low influenza season in terms of hospitalizations. Now, influenza is only reported to public health, to the Department of Health in Wisconsin, if there is a hospitalization. And so Wisconsin as a total has only seen 9 influenza-associated hospitalizations thus this year. What is that being primarily said to be due to? Obviously, there is a greater number of vaccinations that are happening this year that have happened in the prior years. A greater percentage of people being vaccinated. There is also just influenza is spread as a respiratory infection, and therefore all of these great mechanisms we have against COVID, which is also spread airborne, the masking, the hand washing, the social distancing, that is also contributing to our low influenza numbers this year. Okay. As we move on to testing, I want to show our all-time testing so we can kind of get an idea. Now, if we look at our blue line and the yellow lines, what we see is there has been quite a drop in testing. St. Croix County currently has one of the lowest testing rates of all the counties on the western side of Wisconsin. We hover right around 8%. And so our testing numbers have been low, but what we are finding is that although the numbers have been low, we are still finding about the same amount of disease. So we're finding about 25% of those individuals that test by person, that when we were at the height of our pandemic, we were at 30%, and here we've moved to about 25. So we're oscillating still at a high percent positive by person. What I'd really like to see for this to really be comfortable in saying case numbers are obviously down, right? But our percent positive hasn't really dropped. So once that drops, so once we're testing and we're finding a lower percentage of cases and our case numbers are dropping, that's a great indicator that we are moving towards controlling COVID in our community. But I would just like to see our testing percentage drop a little more before I'm going to go ahead and say with conviction that our lowered case numbers are truly indicative of lowered amounts of disease, where we have had a drop. We have had a 5%, so we're definitely on our way. Okay, now one of the great benefits that are coming from this is our vaccine. So what have we seen so far in St. Croix County? We have seen 3,256 St. Croix County residents vaccinated, which is great. And of this, 1,600 were the Moderna vaccine and 1,656 were the Pfizer vaccine. Okay, you can see in the graph here kind of how the numbers have varied. And what we're seeing is just a kind of continual work towards more and more vaccination at more and more sites, including here at St. Croix County Public Health. Like Kelly mentioned, we are currently in our second kind of round of vaccinating. We did our first round here on January 13th, from you see on the graph here on the right of the page. 13th and 14th, we did the group 1A. Okay, and so group 1A, what does that really mean? Group 1A is our healthcare workers. We also did our long-term care individuals, and now we're still, and we vaccinated about 180 individuals. We also included EMS. We were doing some EMS individuals. Today, we are still working on those healthcare workers, finishing up any unassociated ones that wouldn't have gone to a hospital situation, as well as police, fire, and kind of that is our group that we're wrapping up, that we're working on now. In this vaccination clinic. Our goal with this vaccination clinic being conducted today and tomorrow is to have 240 individuals vaccinated. Now note that these might not be St. Croix County residents. We are vaccinating individuals if they are associated with EMS or police within St. Croix County, but they may not live in St. Croix County. Okay, so next steps is kind of the continuation of group 1B. So as we all know, SDMAC is what they are called. They are the organization that decides what groups are going to be released for vaccination. They did release that 65 plus are to be vaccinated. And so the next steps is that at the local health care providers here in St. Croix County, they are going to focus on individuals 75 and older, and they will be contacting them for vaccination. What public health is going to do is then we are going to look at individuals 65 to 74 prioritization, and those individuals who are not associated with a local health care provider here in St. Croix County. We will be contacting those, and the way that we are able to get that information for contact and to set up an appointment is through the form we have available on our St. Croix County website, also on under the vaccines. It is also located here, and this is exactly from our St. Croix County dashboard. This is the last page of our dashboard. There is a link right here to register to receive vaccine availability notification. What this will do, it will bring you to this form here where you will complete it to the best and most complete of your ability. And what that will do is that will then put you into a database where we can move forward in contacting and making appointments. This vaccine notification, just a notice, it will not give you an email saying you're officially in the system. It will not send you out any immediate response. It will just go to a final page and you will then know that you are in the system. Okay, if filling this out is, if you're an individual who is unable to do this or access the internet, individuals who are family or close friends or may fill out this form for another individual, or if that is not a possibility, there is the possibility to call our COVID line, and there is a transfer. Well, we will help you here at St. Croix County get this filled out and get your request in. Okay. The last thing that we saw here is kind of what comes next. So when you do get your vaccination here with us at St. Croix County, we will then schedule you immediately for your second dose to happen with us. And we currently here at St. Croix County have been vaccinating with the Pfizer vaccine. And we also encourage people to complete VSafe, which is an after vaccine health checker. It's through your phone, it's an app, and it just allows more information to be collected about any side effects that may come from the vaccine. Here at St. Croix County Public Health, we have not seen any extreme adverse reactions to the vaccine. And so we are ready and moving forward with a continuation of vaccinating those here in St. Croix County. What we do want to make known is that the state of Wisconsin is very limited on the amount of vaccine that it is receiving as a state. And so that limit will affect our ability to roll through and vaccinate individuals. We will be we will be dependent on what the state is allowing us to do in terms of how many we will be vaccinated and kind of our pace of vaccination. Okay, that is all I have for my presentation this evening. Thank you very much. And I'm going to go ahead and stop screen sharing now.
Ellie, a question I've got for you when you're on the vaccine right now and signing up. How many people right now have actually gone in and filled that information out? Do we know right offhand? I've heard a number, and I'm really I'm impressed with it.
Yeah, and actually I can go in here as we are connected and let you know an exact up-to-date number. It is incredible, and it's very great to see the interest and the that we do have for the vaccine in our county. And currently we have 5,383 individuals who have completed the form for notification and interest in the vaccine.
And that is great news. And we're doing something right, that we're getting the folks to the website and allowing them to sign up. Thank you and everybody else that are a part of that. It's appreciated.
Yep. And I would just like to say, I'm sorry, I couldn't see Dr. McGinnis on here when I was sharing my screen, but I do want to kind of branch off to him as I give you our vaccine numbers. He just has a few words in terms of the vaccine itself and more information thus far. So I'll pass it over to him now.
Yeah, thanks, Ellie. That's great information, and it's good to see that the vaccine is arriving in St. Croix County and beginning to get into arms, because that's where it's ultimately going to do the best good. A couple things. I think as a physician and having seen a number of new vaccines roll out over the years that I've been in practice. This one actually has some really good information and really good data on its efficacy and also on its safety. So I'm pretty excited about this and about its capabilities and its about ability to help us move along that path to get us what everyone wants to be is back to normal. And so I think that I'm very reassured by what I'm seeing. There have been some allergic reactions, which is not unknown or unheard of with vaccines. In fact, I've treated a number of them over the years. And it's part of the clinic when we give a vaccine every once in a while, somebody would have an allergic reaction. And if you're ready for them, they're generally things that are pretty straightforward to deal with. The second thing is that most of the side effects that are occurring with this are related to the fact that your immune system is indeed responding to the vaccine, building the antibodies, building its capacity, doing all those things it needs to help protect you going forward. And so I think that also is very, very encouraging. I think the hard part is it's just simply going to take time because it is coming, but it's taking time to get it all rolled out and get it into the clinics and into people. The last thing is just a comment on the partnership between public health and also the healthcare providers within St. Croix County. The healthcare providers are taking a lot of the lead role in dealing with their own patients who may be over the age of 75 initially, and then moving on from there. And the county is working with other groups and populations. And so that is also very encouraging, and they've done an excellent job of working with that. So when you see the fact that the county's given 180 last week, 240, but there's been a total of over 3,000 administered, a lot of that is due to the work among the healthcare partners. So, and also some of those vaccines have gone into the residents of the long-term care facilities and those staff. So the only other comment I have is related to just the overall numbers and the fact that we have seen significant improvements since we had the huge spike in November and the real concerns and worries about our hospital and healthcare system capacity. And I think that there's a lot of credit that goes to the residents of St. Croix County and the use of some of those basic things of the masking, of being careful about gatherings, the distancing, all that stuff that makes a difference in these situations. And so the important piece of this is we should be cautious with this because that virus is still out there. It's just waiting for people to let their guard down. And we're certainly not down nearly as low as would be ideal to see at this point. So keep the guard up. We're at the beginning of the end. It's going to take some time, and we'll need to continue with these mitigation strategies that I just mentioned, probably until sometime late spring, early summer, or perhaps even later, depending on how things go.
Thank you. Any other questions for Ellie?
I do.
All right, go ahead.
Just wondering what our allocations are looking like and how fast are we receiving shipments?
So we are currently requesting every week to then conduct a vaccine clinic. So as soon as we were approved, we requested and we did our first round. We now knew that we were able to up the amount. So we have obviously increased to 240. I'm hopeful for this current vaccine clinic. And as we move forward, we're just going to keep looking at our space availability, our staff availability, kind of our registration, and our obviously what our allocation from the government is. So it really is a multifactorial decision on how much, but we're going to continue to optimize all of our opportunities and make sure we're doing as much as we can.
Mine was more about the quantity of vaccines that we're expecting to get, not what you're doing. But
right, but that we're expected to. Unfortunately, what we're expected to get, we are. I don't know what we're expected to get. I know what we're able to request, and we requested we requested the 200 doses, which we're able to push to 240. And right now, that I believe is kind of where, I don't know what we're able to request, unfortunately, I guess. We'll have to look at if we stay in this site.
so, we hear Minnesota news all the time. We don't hear any Wisconsin news. I don't anyway, because I don't get any broadcasts from Wisconsin. But, I hear schools get 14 doses. Other places are getting 8 doses. And, what are we seeing as shipments? Only what we request, or Or what are we expecting for shipments?
Right. I know health departments and hospitals alike are waiting to waiting to make appointments because they are making requests for 1,000 doses, or we requested 200 doses. But many sites are not receiving from the government what they are requesting. Some of them are, and so they're not making appointments until they have confirmation from the government on what has been shipped to them.
So have we requested the 5,000 doses for the 5,000 people who have signed up?
Unfortunately, we can't make a request that far out. We can only request on a weekly basis.
And we can only do 200 a week?
Currently, we are working towards moving outside of being at the Health and Human Services facility. There are sites we're looking at to vaccinate large quantities of people. And so that is all in development, but it is also a staffing question of, do we have the staff and the vaccinators to handle this? So there is a lot at play to know what we can request and what we can perform within that week.
Are we working with any nursing students or anything like that that are in the nursing program to help?
There are so many things that we are working on to make this as best as we can. Yes.
And how many approved vaccinating sites are in St. Croix County, Ellie?
Currently, we have Hudson, New Richmond, us, and I'm actually unsure I think that's it. Right, Dr. McGinnis?
I think Natasha at Western Wisconsin Health, I believe you guys are also.
Yeah.
And
Yes,
Hudson
they are.
Physicians as well.
Baldwin is, yep.
So the
And
current
then-
capacity of 240 is what our public health vaccinating site is. So there's other sites, and that's why we're up over 3,000 vaccinations so far.
Correct.
So it sounds like it's a hodgepodge of things and nobody knows really what's happening totally.
I would disagree. There's calls every week, but just so you know, Greg, I apologize, but I'm the epidemiologist. I am not the vaccine coordinator. She is definitely involved in the vaccine distribution today. And so she will have better answers. So just please reach out to Kelly.
Yeah, it's a larger problem than us.
I had a quick question, and it probably is for Bob. And it was just to dovetail off of what Greg was asking. So in terms of resources to help Bob, get shots in arms, is there something we can do here as a public health committee to recommend to the full board? And then I guess a question for Dr. McGinnis or Ellie would be, what is our goal number of vaccinations for the county to really reach the herd immunity that we need?
Yeah, so Supervisor Leaf, the challenge is, without having Kelly present too, I don't want to give bad information, but the challenge is, as Ellie pointed out, is how much vaccine is available for us to request, how much are we able to then request, and do we actually get that amount? And then based on that, if the allocations hopefully improve, we'll look at other methods of how we can distribute the vaccine more quickly and to more people. And Kelly has been very involved in these discussions. She's talked to me about it as well. And we're looking at any options available to us for a broader vaccination program. But we really have to wait and see what the allocations to us will be. It doesn't matter if we request 5,000 doses if they can only provide us with 100. So I think we're trying to coordinate with our hospitals, with our other partners, and determine how best can we get the most vaccine out to the most people in the proper order of priority. And once we think, and I'm speaking very generally on behalf of public health here, but I think as we get a better sense of how much vaccine we can get on a weekly basis, we'll have a better sense of how then to reach out and more broadly impact the communities. It's really our second week of operating a clinic, and some of this is just seeing how it operates and what changes might occur as time goes on. It's a rapidly changing area, of course,
Just
evolving
like everything else
quickly.
with the pandemic, you're building the plane as you're flying it. So I get
We are
that.
building the plane as we fly, but we do have, and I know Kelly and Ellie and everybody else is on top of this. We're trying to get the most vaccine out to the most people as quickly as we can.
And I think in response to your herd immunity question, what you hear from the national experts is a number that's someplace around 70 to 85% of the residents of St. Croix County, nationwide in general, St. Croix County in specific. And so, of course, if you get higher levels of protection, then the virus just simply can't get nearly as far. And so if we can get up into those higher numbers, that would be terrific. That's kind of where we'd like to see things move to.
Anyone else have questions for Ellie?
Chair Osnes, if I could add just one thing.
Go ahead.
The nursing home has a separate process for getting vaccine in their facilities, and they've received through Walgreens, they've received vaccinations for all of the nursing home residents and staff, those that wanted it, this week. And then next week, Orchard View will also receive the vaccine for those residents and staff, for those that want it. Sandy informed me too that they've scheduled follow-up clinics later this month and into next month in March for any staff or residents that didn't receive the first round of vaccine and or folks that want the second dose or are due for the second dose. So they're they're getting to the point now where the staff and residents are all going to be vaccinated, those that want it. And I think by sometime in February, the majority of folks should have their second dose. I believe that's Pfizer too, isn't it, Ellie? Or Moderna?
The nursing homes have Moderna.
Moderna,
Yep.
I'm sorry. And I can get more information or more specific information from Sandy. She wasn't able to be on the meeting tonight, so I'm kind of relaying what she told me.
Okay, very good. And Ellie, thank you again, job well done, and please pass on to your fellow folks at Public Health. You guys are the best of the outstanding job, and we greatly appreciate all your work. Thank you.
Thank you all.
Dave,
Have a great night.
I did have a question.
Okay, go ahead.
And I'm not sure if it will be for Ellie or maybe it's more for Bob, but you know, there is some vaccine hesitancy, and I'm just wondering, for some people, I'm just wondering what type of education or resources we're putting out there to help people understand, you know, why this might be beneficial for them. Is there someone they contact, or what does that look like?
Yeah, for the St. Croix County, on the St. Croix County website, under the vaccines title, there's a bunch of information, both from CDC, from Mayo, from a variety of sources that kind of lends itself to education and those pieces of hesitancy that might be there. Surely anyone is able through our COVID line. We do have a direct line for vaccines and the vaccine sign up, and that line is available to individuals as well. Should they have any direct questions that they want answered in person, we'd be happy to do that as well.
Okay, thank you.
And Natasha, just to add to what Ellie had said, or I'll turn on my video so you can see me. Just to add to what Ellie had said, we worked with the ADRC, and they just sent out their latest newsletter. We do have vaccine information in that newsletter, so I'm not sure if that reached people's mailboxes yet. We also have a public health newsletter that's going to be going out soon. It was a little delayed, but we're going to be getting that out shortly, and that also has vaccine information. We will have some more information on the vaccine page probably by the end of this week, and we will be updating that as we move forward and as we learn more information. We are partnering closely with Pierce and Polk County and the local healthcare facilities to make sure that our messaging is consistent as well.
One more follow-up.
Yeah, go ahead, Greg.
Of the 5,000 that are signed up, how are you choosing who gets vaccinated first? Is there a lottery? Is there a priority group of the 5,000? Or is it first signed up, first come, first served?
Right. So as we know, like the groups, SDMAC has been making additional recommendations. The organization that does understand, that makes the recommendations and approves them for which individuals. They met this morning, and even more kind of stipulations were put forth for recommendation on individuals and prioritization, and those may come out tomorrow or the next day. So it is a rapidly changing situation, but as we stand now, we are looking at first those that are being signed up, and then of those that are signed up, we're looking at pre-existing conditions that and with age. But as of that night now, that's the only tiering system that we're working with is age, and or not by age, but being above 65 with pre-existing conditions.
Anyone else with a question? Okay, and again, Ellie, thank you. Job well done. We'll move on to item number 2, Health and Human Services monthly financials. Faye.
Yep, I am here.
And you are still smiling, and that's good.
So the financials for December were included in the board packet. This does represent what's currently posted into December of 2020. These are not final December numbers. Oh, I'm getting an internet connection is not available. If you lose me, let me know. So there will continue to be, we got paid here in January. That first payroll in January will in full be posted back to December of 2020. We will have operating expenses and local revenues that are received in January that will be posted back. And then our state revenues will go all the way up until maybe even May. So between February and March, there's final reports and reconciliations that are submitted for our state contracts. And then as the state processes those, we get our final payments. So those come even into March and sometimes as far as May. And looking at the financials, if we're back at page 1, we've received the majority of our revenues in. We have, if you look at the total revenues, only 8.18% remaining compared to budget. And as I said, those will continue to come in. Overall, our expenses are still a little below what they were December of last year. Because there's more operating expenses that will be posted, I think that will be very similar by the time we're done. I really don't have anything else specific for the other departments. When I get down to nursing home, so all the way on page 27 and 28, our health center campus overall, we're showing a negative balance. The nursing home itself is very close between its revenues and in expenses. They are different and they won't have other revenues or expenses posted back for the most part. They're much more on accrual basis. So their December revenues have already been posted in full. The only thing we are still expecting some additional COVID money. So for their infection control, and there was a Wisconsin general relief funds that were available in relation to the extra expenses they incurred. So there are a couple pots of money that should still come in here that will help to offset some of their losses. Our Veteran Services Department is right on track with their expenses and revenues. And then the last slide, the purchase services. This just reinforces what we've been talking about each month. Children's services expenses, are over budget. There's a lot we've been doing to work with that. There is some additional funding that we've applied for that we hope to get reimbursed that will help to offset those additional expenses. But otherwise, the purchase services between CCS and behavioral health were lower than what was budgeted. So that's why HHS overall is still, on track for our revenues and expenses. Any questions for me?
That's a good sign. You're doing something right, Faith.
I try. I'm here till the wee hours of the night working on this.
And am I correct, that we may have to go through the end of February in order to receive some money from Madison?
Right, so.
Because we got that delay, I guess, everybody's.
Yep, for our state revenues that come from, Department of Human Services, those will continue to come, into March and even maybe April. Our local revenues and other ones, we have to, we can't post them back because I have to do the final reconciliations by mid-February to submit to the state to say what our losses are to get those extra reimbursements.
Anyone else have questions? Okay, seeing none, thank you very much, young lady.
You're
Keep up
welcome.
the good work. We'll move on to item number 3, the approval of the Community Development Department's spill response plan. Bob.
Yeah, thank you, Mr. Chair. Last November, Tim Stiber, the Community Development Department's administrator, and Cole Webster, resource and outreach specialist, did a presentation on the manure spill and brownwater event response plan that's included in your packet. And if I'm correct, I believe what we need to do, what the board would need to do today is to vote on approving that plan that was included in your packet. Both Tim and Cole are available if there are questions prior to voting or any discussion needs to happen prior to that.
Anyone have any questions? Deb, go ahead.
I was just wondering if there was something, Virginia Drath raised that issue about if a spill occurs on a Friday night, and is there something in the plan? I have read the plan, but I don't remember if there was anything in there about responding over a weekend or something like that. Obviously they could probably call like the sheriff's department and they would call public health, and there is that system in place. So I'm not sure how we could address that.
Tim, do you want to take that?
Yeah, I can take that. The way that we'll reply is not going to be that different. Yeah, I think 3 staff right now that we're on what's called the DNR spill response hotline. And so I get notifications on my phone. So most of them happen on Friday night or sometime when you're not at work, right? That's when it happens. And your phone goes off and you get a text, you get a message. And at that point, we'll determine if it's, who has to run in and maybe take a look at it. We'll respond to those. They do respond on the weekends. But I don't think we've worked anything into the plan that specifically talks about that, but we do have 24/7 coverage as far as notification is concerned right now. So the whole notification process is either a phone, which all phone messages get forwarded to my email anyway on my phone, or the spill hotline goes to our phones as well. So it's not that we're as available as we are during the week, but certainly we do receive those notifications. So
I think her concern was that how would you notify, like if it was a spill and there was it would impact area wells, how would you notify those people that could be impacted on that? You wouldn't want to wait until Monday. You wouldn't want them to be using their water. I think that was her concern. So I'm not sure if that's addressed
Yeah,
adequately or if we
Yeah,
need to do
the
something about that.
plan, the plan will not ever be that fast. But this, you got to keep in mind that this particular plan replaces basically a blank sheet of paper. This is our first effort to organize ourselves and make sure that we do the right thing as far as checking out the site, evaluating the severity, and then notifying individuals. So the last thing we wanted to do was to notify individuals without actually checking it out and looking online to see where that water's going. And even at that, I think Cole could speak to this because he's more of our modeler than anybody that we have available. Even when we do have all the information, it's quite tricky to figure out where the water's going to go. Maybe you could speak to that, Cole.
Yeah, so the difficulty specifically with manure spills is that there really isn't, at the current moment, there really isn't software to replicate the movement and the spread of bacteria through groundwater. You know, general groundwater movement is fairly easy to replicate and model. Not to say that it's quick to model. Building a model for a specific site isn't a quick process, and so that's one of the difficulties with trying to incorporate modeling into this type of plan with a quick response. But really the difficulty with this specific type of issue comes to the fact that knowing how bacteria is going to essentially behave in a groundwater system is a big question in the groundwater modeling realm. And so, you know, really this plan, what it's getting at is using the available tools that are, you know, we can use within that time sensitive manner to make a quick decision and an informed decision too.
Deb, does that help you out at all?
Sure. Yeah, that's fine.
Okay. Anybody else have any questions or comments? Not seeing any, I would entertain a motion to approve.
Mr. Chairman?
Yeah, go ahead, Scotty.
I would move to approve the St. Croix County Manure Spill and Groundwater Event Response Plan.
Second.
Any other further discussion? All in favor, say aye.
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 Opposed? Motion carries. Thank you. And thank you, Tim and Cole, for your great result. Thank you.
Thank you.
Thank you all.
We'll move on to item number 4, Children's Services update on foster care and out-of-home placements. Bob?
Yeah, thank you, Mr. Chair. I've asked Julie Krings, our Children's Services Administrator and Operations Manager, if she would expand a little bit on the issue of child out-of-home placements and foster care. As Faye pointed out in our budget, our purchase services are increasing as a cost related to both of those, which is the cost end of it. The human side of it is we're also very interested in doing something to prevent child out-of-home placements and ensure that foster care is available to those that need it. I've asked Julie to provide a fairly brief presentation on that topic, and then following up with that after she's done, Becky Kerr from our CCS division, Comprehensive Community Services, and Char Lopez from our Behavioral Health Division will do a couple of also brief presentations on children's mental health. But they tie together a little bit, and Julie will stick around for the second presentation to also add some context to that. But I'll turn it over to Julie now so she can provide you with a little more information about children's services and these particular topics. So thank you.
Good evening, board members. I did put a PowerPoint together and it is part of the board packet. If whomever's doing the board packet, we could put that up on the screen. That would be awesome. Prior to COVID, I was talking to you guys a lot about, oops, sorry, all of a sudden my screen froze up. I'm like, what's going on? Sorry about this. You gotta love the technology. So prior to COVID, I was talking to our Health and Human Services Board quite a bit about the other crisis going on in our county, and that's the child welfare crisis. And for some of you board members that are newer, I thought tonight would be a good time just to explain a little bit about what's been going on. So St. Croix County is not alone in the child welfare crisis. There's a national crisis that has been occurring in regard to child welfare and kids in out-of-home placement. And it's primarily due to alcohol and drug abuse. And what we're seeing in our county is specifically more methamphetamine and alcohol. A lot of times if you're looking at and you're hearing about the child welfare crisis, you're hearing about heroin or more of the opioid pieces. We see some of that here, but our primary drugs that we're seeing as it relates to child welfare is alcohol and methamphetamine. So just to give you just a little bit of background around that. So next page, please. Just to give people a little bit of context of why children are removed from the home. First, I want everybody to know that we operate and we base our work on least restrictive possible. So sometimes you hear in the news that social workers get a bad rap that, oh, they just want to remove kids from their home. That is the last thing that we want to do. We work with everything that we can to try to keep that child safe within their home. If we're not able to do that, then we obviously look for relatives to see if, grandpa and grandma can help out, or aunt and uncle, before we even to look at foster care. But these are some of the reasons why kids are removed from their home. And I kind of did it in order. So our number one reason is neglect. And that's because of either alcohol or drug abuse by their caregiver. With COVID, we are also seeing an increase in domestic violence. Certainly there was domestic violence prior to COVID, but with people being around each other more, we are seeing more CPS reports about domestic violence. And oftentimes kids get injured during that act of domestic violence between partners. Then also just medical neglect, just your historical physical abuse, certainly sexual abuse, and then also kids needing special care or services that their parents are not able to meet. And those are kids with special health needs or very complex mental health issues. And then also parent incarceration, if both parents happen to be in jail or prison. And then also on our youth justice side, our primary reason for out-of-home placement is for youth who have very complex mental health or behavioral issues, certainly community safety, and then also consequences through the court. Next slide, please. Just to give you a little bit of a comparison, here's just a slide that shows how many child protection reports we receive each year. 2016 was when we really started to see an increase in our child welfare services. We did not really slow down because of COVID for child protection. We had a little bit of lull when schools were out in March and April, but certainly you can see our numbers, and compared to previous years, we are just really close. And also just to reiterate that during this COVID crisis, we are doing in-person services and children's services. Certainly we take advantage of technology when we can, but we are going out and meeting with people in person and doing home visits, and that has continued since the start of COVID. Next slide, please. One of the things that this child welfare crisis has continued to impact not only children's services, but also other services within the county. So a CHIPS is a child in need of protection and services, and these are cases that go to court. So this involves the judicial system, DA's office, and the sort. So if you look back at 2013, we had 33 families go to court because of child protection, and look at where we are in 2020. We had 80 families, and oftentimes there's multiple sibling groups related to that. So while it's 80 families, there might be more children involved than just 80. And again, it's been primarily due to substance use, alcohol, and drugs. So you can really see how we've really ramped things up in child protection. Next slide, please. This will also show you just a little bit about our youth justice. Whereas our child protection numbers have went up, our youth justice, so this is juvenile delinquency or insurancy, these numbers have went down. And this has been a pretty common trend around the state and around the nation. And what we've done over the past years is we have reduced the number of workers that are providing youth justice services and moved them into child protection. And a lot of our youth justice workers are carrying caseloads that do have child protection cases just to help out with a lot of the overflow. But while the numbers have gone down, the complexities of youth have gone up, and we're really seeing a lot of youth in our youth justice system who have very complex mental health needs. So the work is still really intense while the numbers have went down. Next slide, please. This is a slide that shows our out-of-home placements, and this is a point in time. So this just takes a look at, if we were to take a look at a snapshot on December 31st of each year, this shows the amount of children in out-of-home placement. So if you take a look at 2016, when we were starting to experience that crisis, we only had 38 kids in care compared to now at 82. I just looked today and we're still at 82 children in out-of-home care. One thing to really point out is to take a look at where our children are being placed. I've said this before to board members, is that we have family members that are stepping up to the plate to care for their family. So that's grandmas, aunts, uncles, grandpas, neighbors. They are really helping us out and helping their family out. So we don't have to take a look at alternative care. And again, we're always looking for relatives first. And this is something to be very proud about, because not every county sees this. So that's just something to be focusing in on. One of the things that has been difficult is because we have children with some very complex needs, we've often had to look outside of our own foster care resources and looking at treatment foster care. And so sometimes when we look at treatment foster care, children are placed a little bit farther away from their home, which is not what we want to do, but just because of the lack of resources that we do have. Certainly COVID has presented us with so many challenges regarding children and the child welfare system. It's insane. And I really want to commend my staff for going above and beyond in doing the work during this time, because again, they're out in the trenches during COVID, and nobody has complained one bit. They're like, bring it on. And one of the things that's difficult is with COVID is like, so you call somebody up and say, hey, you want to take placement of this child. And not only do you have all the complexities related to that child and family, you also have that COVID factor in place as well, and what they might be exposing their family to. And then as well as some of our more extensive placements like group homes and detentions and residential centers, they've had very specific and stringent guidance for COVID protocol, which we want, right? Because we want people to be safe, but it has really put barriers in place for our child welfare system. And at times we have unfortunately not had resources in the state of Wisconsin for placement for our kids. So we have had to have children placed outside our state, which we do not want to have, but we've had to have that happen this past year. And then also, how do you get a kid to another state during COVID? We actually were able to utilize, the state has a couple of airplanes. So we actually utilized one of our state airplanes to take a child to a placement, and the family was able to go with. So we were really working closely with our state on that. So just a lot of work that goes into that. Next slide, please. So like I said, we do have some pretty limited resources for our children in out-of-home care. We're continuing in this child welfare crisis. It really kind of started to spike in 2017. And the other thing is supply and demand. Because we're not alone, every county in the state of Wisconsin is having this child welfare crisis. So we're all competing for placements. So it gets to be really difficult. And again, we just don't want to put a kid in a facility. We want to find a place that will meet that child's needs and work with the family to make sure that they get what they need. The other thing is we want to make sure that kids have that school stability. The last thing we want to do is to have a child switch school districts. New set of friends, new teachers, they lost that support network. So we have worked really closely with our school systems and our foster care providers to do whatever we can to keep children in their school of origin. There is actually federal legislation. It's called Every Student Succeeds Act that requires human services and school districts to work together to come up with a plan. And I do need to commend our school districts that they have been phenomenal to work with and really getting creative and helping us transport youth that are outside their school district. And oftentimes we've got family members doing that as well as our foster families. So we do our best to try to make sure that that child remains in their school of origin. And then also just the COVID impact. We've also had to deal with children being positive for COVID and needing placements. That has been very stressful to say the least. We do have a foster home that is willing to take somebody who is positive for COVID at that time. And we have certain protocol worked out with that foster family. And again, like I stressed, my staff have been so critical during this process, but also our foster parents. I did another presentation last week and I said our foster parents are the backbone of children's services because they're opening up their homes, middle of the night, they'll get a call. And they're right there and willing to partner with us and also taking on some very complex mental health challenges. Just to give you a little update about our current foster homes, we have a little bit of a level system in the state of Wisconsin. So a level 1 means a foster home that is a relative. So somebody who might be an aunt or uncle might become licensed to become a foster parent. They do this so they're able to receive a small stipend and for the child to get medical assistance. And so we have 6 people that are licensed right now, and we have 11 pending. So again, that just shows how many people have stepped up to the plate to care for their children. And we have a time frame. I think it's like 45 days to get people licensed. And so they're just in the process of being worked out. And the amount of level 1 homes range because if we find permanency for a child, then they're not going to stay licensed because there's no need because they're only providing care for their relative. And then level 2 homes are people just in the community that just, hey, I want to help kids out and become licensed. And right now we have 24 homes licensed in St. Croix County, and that's usually around what we average. We've got 1 pending. I actually had another person contact me this week wanting to be a foster parent. I'm like, oh, this is so exciting because we really are needing foster families to help us with our child welfare crisis. One thing that we have started is a foster care recruitment and retention team. We started this prior to COVID, and we've had a lot of great strategies. And we have some very successful recruiting. But then COVID hit. And so now we're trying to rethink some of our strategies and trying to figure out how we can recruit people during this time. But if anybody knows of anybody that's interested, please have them contact us. Next slide, please. Bob had asked me to share just a little bit about the process of becoming a foster parent. We've got an application, go figure, form when you're a social worker. That's just a little social work humor. So we take a look at their motivation. Why are they wanting to become foster parents? When we hear, I'm working, I would like this to be my income, that's usually a red flag for us because we usually sometimes the wrong reason. So we really try to screen those people out, but we're really looking for people who are motivated and invested in working with families. We have a very complex assessment that we're required to complete through the state of Wisconsin, and it's called the SAFE study. You have to be certified to do this type of home study. I went through the process. It's very comprehensive. We take a look at everything related to their family, how they function, and really ask people to be an open book and be honest. We're not looking for perfect people. In fact, we want people who are not perfect because we want people who are human beings, right? And we also take a look at the physical environment of the home, smoke detectors, square footage, safety, all that kind of stuff. And then do obviously comprehensive background checks, and then references as well. It usually takes about 60 days to get somebody licensed for foster care. Sometimes it takes just a little bit longer because some states are a little bit slower with background checks, because if somebody lived in Texas, we have to wait for Texas to get that background check. But I've got our foster care coordinators information on the slide. So if you have somebody that's interested, please share that with them. Next slide, please. So obviously when Faye Stranke was talking about budget stuff, certainly our child welfare crisis has had a serious impact in our children's services budget, primarily because of out-of-home placements. And we're having to take a look at treatment foster homes just because we're needing additional homes and just people that are able to really work with very complex children. I had mentioned that we have some very complex youth that we're working with right now that have significant challenges. So we are needing to look for out-of-state placements even for some of those youth, because nobody in Wisconsin will accept them. And those get very costly very fast. And I'm not just talking about the out-of-state placements. It's about the same cost if you put somebody in Wisconsin than another state. But once we get a kid in residential, we're looking at close to $20,000 a month. And then there's also a lot of miscellaneous expenses, transportation. I had mentioned keeping kids with their school of origin. Also, COVID has had a huge impact because a lot of services have went virtual and people do not have that technology. We were doing good when a lot of schools were remote because the kids had laptops and parents could use them. But once summer started, laptops went back to the school. So parents lost that form of technology. So we've had to purchase some technology for families. And then also just with the COVID crisis, we've had to provide some rental assistance, which we get funding through the state to do. Another thing that is a newer trend for us, it's called subsidized guardianships. And this is a way for people to find permanency. It's where out-of-home care provider will take guardianship of a child. And then, hey, you know what, they're their guardian. There's no need for child protection to be involved. We close our case. But when they're a subsidized guardian, they continue to get a monthly stipend for the care of that child. So when we close out our case, we are still responsible for that subsidized guardianship payment, whether they're a county resident or not, or even if they're a state of Wisconsin resident or not. And this is something that's newer to Wisconsin, and it's just proving to, while it's a good option for kids to find permanency, it's an added budgetary implication for county human services budgets. There is action with Wisconsin WICSA, the Wisconsin County Human Services Association, to take a look at when somebody gets a subsidized guardianship for the state to take over the payment for those. Because that's what happens in child welfare is if we go through a termination of parental rights, the minute or the day that parental rights are terminated, the cost of that child goes from the county to the state. And so the counties association is saying, hey, let's look at these subsidized guardianships in the same way that we do for adoption cases. But right now we have 10 subsidized guardianships where we are responsible for funding that until the child turns 18. Again, whether or not they're a county resident. Next slide, please. So what are we doing, right? We are in the middle of a child welfare crisis. We're in the middle of a COVID pandemic. And the last thing that we want to do is place children outside their homes, and really wanting to take a look at that prevention effort. So a lot of these things on our list started pre-COVID, and we're continuing to do that. The number one thing is we're trying to take care of our staff. We're trying to prevent burnout, and we want to retain our staff, because if we have a lot of turnover, more expenses, and whenever there is high turnover in an organization, that is a direct correlation to children are in out-of-home care longer, and we don't want that. So we're trying to do our best to support our staff and ask them what they need from us. And then the other things we're trying to do on a continuum within children's services. So really early on in birth to 3, we're focusing on that social, emotional, that attachment and bond of parent and child, and that infant mental health. Again, more of those prevention strategies to prevent them from becoming into our child protection system. We've also implemented parents as teachers. This was one of our strategies, but it got delayed because of COVID, but our staff just got trained in December. And this is an evidence-based parent curriculum. And we're hoping that this can enhance some of our supervised family interactions. So when parents interact with their kids, when we're supervising that because of safety, we are hoping that we can bolster that by enhancing parenting skills at that time. And this is the same curriculum that our Family Resource Center and Head Starts utilize. And we've partnered with Pierce and Polk County on this effort. I've talked to the board before about Triple P. That's another evidence-based parenting program that we've implemented. We also have family-centered treatment, which is an intensive in-home program for high-risk, high-need families. And again, that's evidence-based and approved by SAMHSA. We also have family teaming. And, Faye had mentioned that we are looking for every penny we can in our child welfare system. And a couple of these next ones are funding resources that we have applied for and have been successful in getting. So targeting safe and stable families. This is funding to try to keep kids in their home and prevent out-of-home placement. And this is one thing where we will help pay for rent. So rather than somebody becoming homeless and then ending up, what are you going to do with your child? We will pay their rent, because we would rather have somebody remain intact in their home than have to enter our child welfare system. And then we do a lot of other things with that too. We've also had several, unfortunately, several children that have been victims of sex trafficking in our community, and we've gotten specific funding, 90 grand for that. And I have to put that in there because I'm kind of proud. And then I applied for another application and hoping to maybe get another 90 grand here in the next month. You'll hear me scream when we get the award. We've also partnered with a variety of community organizations. The United Way and the Family Resource Center have been absolutely instrumental in working with us. One thing new that you'll hopefully be hearing about is parent cafes in 2021. We are partnering with the Family Resource Center on that, working on foster care recruitment and retention. The other thing is because of COVID, it's just put a stress on our foster families. Kids are home during the day. There's more meals that they have to provide, maybe childcare, and then some of our other other facilities where they've had to hire staff, the state has implemented COVID payments. They've done it twice now, kind of like a stimulus payment, but really for placements where they've gotten an X amount of dollars to help offset some of those COVID expenses. We're just the pass-through. We pay them and then the state reimburses us. Another thing we've done is work closely with our behavioral health unit to try to prioritize substance abuse referrals and making sure that parents get in there quicker and not have to sit on a wait list. We also participate in our CJCC Substance Abuse Committee. We also work closely with our corporation counsel on the termination of parental rights. We never want to do that, but in some cases, that's just what needs to happen. And we've been able to find a lot of children permanency through that. And there is so much more. If my staff are watching, they're like, Julie, you forgot this, you forgot that. But Bob told me to keep it short. No, he didn't. But I just wanted to be concise. So now that I've rambled on, does anybody have any questions for me?
Mr. Chair, I have a question.
Go ahead, Kara.
Julie, thank you for that very informative presentation, and really thank you to your staff, to you and your staff. It's obvious you're doing a lot and being very creative is trying to serve the younger and more vulnerable citizens in St. Croix County. So I really appreciate that. You mentioned in your presentation that you've been in a child welfare crisis since 2017. I could be wrong about this, but I suspect between you and you've had conversations about, well, we could do this if only we had the resources or if only we do that. So my question really is, in a hypothetical world where you had unlimited resources, what areas would you really focus on, first? If you had unlimited resources to do it, where do you think would be the most, bang for the buck and in serving and helping the children of St. Croix County?
That's a great question. And my answer is what we're already starting to try to do, really focus in more on that preventative focus, that early childhood, and start really young when they're babies and really engage parents to help build their capacities and move forward. And again, obviously look at evidence-based programming. So a lot of what we're already doing, but probably a little bit more if we had that unlimited pot of money you're talking about.
Anyone else with a question? Comment? Well, Julie, we thank you. And by the way, thank you for your time yesterday afternoon. We had a quick conversation over at the government center too. This was some great information, and I hope it was rewarding for not only our board members, but folks that view us on television too. This is great information for them as well. Obviously, you got a heck of a great staff, and Bob, you've heard me say it before. St. Croix County is blessed not only with public health, but all our human services areas as well. And this is another great area that we do a fantastic job with. So hats off to each and every one of you, Julie.
I will pass that along to my staff. Thank you.
We'll move on then to children's mental health needs. Shar, do you want to start, or where do we want to go, Bob?
Yeah, well, thank you, Mr. Chair. Yeah, we can go to Shar in just a second. I do want to just also say thank you to Julie and her entire staff. We're very lucky at St. Croix County to have her and her staff. They literally problem solve all day long and are as compassionate as you could ever hope for. And just one last point on that. Ideally, in human service work, the challenge is moving away from crisis-centered service delivery upstream to preventive care, as Julie mentioned, and getting to the point where we're trying to keep people well rather than treating them after they've already become ill or entered into crisis. And that's the challenge for all human service departments. But I do share that vision with Julie of internally realigning our systems a little bit and looking at ways in which we can be more effective in preventive care and wellness management instead of crisis management, which someday I hope we get to. That's how we keep the population healthy, and that's how we prevent these kids oftentimes from being in these situations where they're being removed from the home. So just that caveat. But to move on to Shar and Becky Kerr, I asked if Shar and Becky would co-present on the topic of children's mental health, especially in light of this pandemic and some of the pressures that are placed upon families and children, to let them explain a little bit about the services we offer and some of the solutions that we're looking at. Again, looking at children's mental health as a part of overall healthcare, not just a separate thing, but how this is impacting children, I think is important for us to understand, and how we're as a department responding to it. So I'll turn it over to Shar and Becky at this point, and let them do their presentation.
Thank you. And I want to reiterate some of the things actually what Bob and Julie just said is the mental health care that is available to the adolescents of St. Croix County really starts in the schools, and doing some research and trying to see what the schools do. CISA 11 has a great format for the schools to really work on what Bob was talking about, that preventative care and that wellness management. And so they're really the eyes and ears for us. Many teachers spend more time with our kids than we spend with our kids in a day. So what we do where we can pick it up from there is really a lot of what I talked about a couple weeks ago. They're all available to the adolescents as well. So I'm just going to take a little bit of time and kind of reiterate how that relates to adolescents. So all adolescents, the emergency services, outpatient mental health treatment, substance use disorder treatment, comprehensive community support services, and then what Julie was talking about, the family-centered treatment. Those are all available. We also have inpatient treatments that are available for adolescents. So the way that a student or a youth or an adolescent can access emergency services is through our phone line, our crisis line. We receive phone calls from counselors in schools, psychologists, teachers with concerns or wanting to ask questions about services for youth. We have walk-in available 8 to 4:30. We also work hand in hand with Northwest Connections, who is available to anyone, not just adolescents, but simply by dialing 911 and asking to speak with the behavioral health worker. Emergency rooms as well can do crisis evaluations, and they will engage our crisis services if necessary. And again, always 911 is always available, and if in question is a good default. We have some suicide hotlines that are available to a specific population. One of the things I tried to look to see is the services we have. As we know, the LGBTQ plus population can be have a few more challenges when it's coming to, and as being an adolescent as well. I was thrilled to find out that there are numerous services within our community. We have a lot of really great therapists who have specialty in that area. So at St. Croix County, we have 2 psychiatrists, 2 psychologists, and 4 mental health therapists that do the outpatient counseling. We're doing everything currently. There are 2 psychologists that do see people face-to-face if necessary, but everything is being done teletherapy. We do individual, group, or family therapy. We offer psychological evaluations and medication management. We look at a multidisciplinary team focus. We have several teams that people within behavioral health, not just mental health, but all of behavioral health are part of, so we're not missing anything. We team referrals to make sure that we're offering the proper services to the adolescents and the families. Our interventions are client-focused, solution-focused, and trauma-informed. And we also have a work with the enrichment, because literally it's in our backyard. The New Richmond School District in yearly doing depression screens they'll be doing them via technology again this year, but making sure that we're touching base with our schools and that we're working with the counselors over there as well. We also have adolescent inpatient treatment, which it can come in the form of a voluntary placement, emergency detentions in the event that it isn't a voluntary placement. And we also have substance use services that are available for adolescents. They can do the assessment and receive have recommendations, including no further services, maybe some psychoeducation, outpatient treatment, or maybe inpatient treatment. We also offer individual and group treatment and therapy for those adolescents. Now let Becky talk about her CCS programming.
Thanks, Char. Yeah, CCS, we definitely work with a lot of youth and children with mental health needs. We really partner with BH, behavioral health, kind of as Char indicated, with some of those outpatient programs. And we definitely partner with children's services too, to ensure that the recipients that we have get the services that they need. And also try to look at what other programs, if they're working within CCS, what other programs within the county might be able to support them in, I should say, in or outside of the county. So within CCS, we have the ability to provide a wide range of services to meet their needs, and I'll kind of go over those on another slide. So do we want to go on to the next slide? All right, within CCS, outreach is ongoing with our schools, teachers, and support services. It's kind of like Char said, our schools are really our partners in working with those kids. We really want those school staff to be aware of the services that we provide, so we can help with early intervention to support youth and children and their families and keeping those kids in their homes. We're beginning the process of outreach to just our community partners. In general, I don't know that the community is really aware of what CCS can provide or how we can help. So we want to make sure that our community partners are more aware of the services and how we can help in those situations. We're also reviewing our CCS contracted providers on an ongoing basis to ensure that we have the capacity to meet current recipients' needs, as well as find out where we might have gaps. One of the gaps that I'd heard about recently is looking at music therapy. We've had some requests for that, but it's not something that, honestly, it's not something we have in the local area. So that's going to be one of those things that we reach out to see if we can find. All right. I put this slide in here just to kind of give you a visual of what the recovery team model is and how CCS supports our recipients. When working with a child or youth within CCS, that child and their family or their guardian really is at that core. They're our customer. So the recovery team really provides ongoing assistance to help those recipients and the guardians or parents identify what the strengths are, what the needs are, identifies the goals, the outcomes that they might have, what the priorities are, any preferences or values. And the recovery team is really there to support them on their journey. So the focus within CCS is on psychosocial rehabilitation, so that recipients are really the driver of their own bus, that we're not telling them what to do. And in CCS, we really work with them and not do for them, so that hopefully they can learn those skills long-term and won't keep coming back into using our services within the county. The steps to recovery is really individualized, and they can include both traditional services and non-traditional services. And on this slide here is just some examples of what you would consider traditional services within CCS. And this is where CCS gets a little bit unique. We can do a lot of non-traditional services. And those services for youth and children can be, oftentimes it's actually a combination of traditional services and non-traditional, but those non-traditional services that we can do really sometimes meet those needs for those kids. So some of those, just to give you some examples, some of those non-traditional services, we can use boxing, yoga, art, equine therapy to help learn different ways of coping and dealing with those pressures that they might have. For kids, as Shar had kind of said, for kids that might have LGBTQ needs. We have providers that really focus on that and can work with them on mentoring and counseling so that they can work through any issues that they might have related to those needs. We're also really fortunate to have a parent support group, or parents, it's called PFLAG, that's in River Falls. It's a support group for the families and kids or youth with LGBTQ needs. All right. And then this, Julie touched on that family center treatment. We use this a lot in CCS, so I'm not going to go over this again since she touched on that. So we can go to the next one. All right, and this is our opportunities. So what opportunities do we have out there? We have that ability to be teaming with the existing programs in schools to assure that their crisis contacts are known to adolescents and families, and also to make sure that they know what resources are available within the county as well as within HHS. We're really seeking opportunities to assist in partnering with programming related to mental health support for our youth and kids, and providing training and informational sharing with community stakeholders. That's another opportunity for us. So I don't know if Shar, if you or Julie, if you guys have anything to add, but otherwise we can certainly try to answer any questions you may have.
Any questions for Rebecca?
I have a question. Thanks for this presentation and for all that you and Julie and the whole team do. Really appreciate all of the work. It's very difficult work. What happens when someone ages out of the public schools? You know, we lose that school connection. Do they stay clients, I guess, or whatever you refer to them as? Do they age out? What happens? Is there kind of a handoff to more adult programs at that point so that there's not a gap in treatment or care?
Well, I can start, and then Shar or Julie, you guys can jump in. Within CCS, we work with the whole age group, so from kids all the way to adults. So they don't age out. If they continue to need services after they turn 18, we continue to work with them and we'll help them. So if they need a referral potentially to the EDRC for long-term care, we can work with that. Likewise, excuse me, I have a dry throat tonight. So I guess, I don't know if there's anything else to add necessarily to that, but we're really trying to coordinate
it's
that.
Continuous then, that's great.
Mm-hmm.
And if I can add, in child welfare and in youth justice, we are able to, if a child is placed outside the home, we're able to work with that child until they graduate from school. So even beyond the age of 18. And then we also have an independent living skill coordinator that works with kids 16 to 24. I think it's 24, maybe 23 years old. And they really work to bolster that independent living and that launching. So housing, helping with jobs, employability skills, and the such. So trying to really prevent that population from becoming homeless or into other types of systems.
And those are part of the service array within CCS as well, is that skill development. So depending on what age that person is, it doesn't really matter. If that's a need that's identified, we can work with finding providers to meet that need.
Asha, go ahead.
I'll echo the thanks to all of you as well. Very hard work, and you do an amazing job. I'm just curious, maybe for all of the services, if there are waiting lists or how you're keeping up with the demand, because I know these are very high demand areas and we don't necessarily have enough providers in our region.
So we're able to access for outpatient, we're able to access very quickly, especially for the adolescents.
Yeah, and in CCS, we don't have a waiting list either. Some of our youth workers are also, they work with the CLTS kids. And I don't know, Julie, if you want to touch on a little bit, the state has actually implemented a waiting list. We have not had one in St. Croix County for quite a few, well, I think 5 or so years. But the state has implemented one now as of January. So
Yeah, Becky's absolutely right. For CLTS is that we don't, children with long-term support, so physical disability, developmental disability, and children with mental health, is that the state wants to reduce wait lists. So rather than counties having their individual wait lists, the state has a wait list. So even though we don't have a wait list, we have to go through the state in order to open people up for services. So it's a bit of a red tape for our consumers, but we're working through this as quickly as possible and providing feedback with the state that we might need to take a look at a different approach. But it doesn't overly delay services.
That's great to hear. Thank you.
Greg, go ahead.
Thank you for all you're doing. In the past, when somebody was in crisis, they were handcuffed and taken to Oshkosh or Winnebago or wherever. What happens now if somebody's in crisis, an adolescent?
There's the same crisis team that is available. We work with, whether if it's at the school, or we have Northwest Connections that works with us doing the assessment.
So they're not transported cross state?
Depending upon if they need a crisis, if they need an emergency detention, we need to find the nearest place, and that in itself is an issue. But
well, I thought there was something in Eau Claire or something in mid-state, or Eau Claire was having a center, and
for detention, for delinquency,
emergency room, and they're handcuffed, transported about 5 hours in the back of a police car, and in the past they were across state.
So it could be 5 hours depending upon where a bed, if it's an emergency detention and we need a bed available for a youth, it might be a long trip. There is an option for doing voluntary placements, so if a parent can drive them, law enforcement wouldn't be included.
So in the past, that there was no decision, the parent couldn't get involved. Does that change?
We're always looking at the least restrictive. So if they can go home with a community plan, that's absolutely the first thing we want. If there's a safety plan that we can come up with, that would be where we'd start. If there was a need for a detention, an emergency mental health hold, and they're volunteering, they're willing to go, and the parents willing to take them, they can facilitate that. And if it was the latter where they're not voluntary, then that's when if law enforcement thought that was necessary, then that's when that would happen. It doesn't happen as often as going home with a plan.
And if I may jump in, SHAR staff have done an excellent job of coordinating some of those crisis services. And we also have crisis stabilization beds, if you will, available. They partner with our local Positive Alternatives group home. And let's say that an in-home safety plan won't work for those types of things, but a child may need to go for a place just to kind of enhance safety plan. SHAR staff will work with that. And that's what a lot of our youth will do, where they'll go on a crisis stabilization voluntary basis and then return back home.
Any other questions, comments?
I would just comment in general, the things that we're looking at in our department here is how can we do away with silos? Because I know, Julie, you hate silos. And look at our different service divisions. CCS, I really like that model. Behavioral health and children's services, and all of our other divisions, really. But how do we provide to the public a menu of options for somebody that needs help with whatever it is, behavioral health issues or financial, whatever they might be? Provide a menu for people when they come in and say, what are your needs? Here's what we can provide for you based on all of the things that we do here in the department. And behind the scenes, do all of the work in coordinating that. So we have a more coordinated continuum of services that we can offer people as they come in the door and they don't see all of the bureaucracy or funding challenges that go on behind the scenes. And we can provide those services in a coordinated fashion with no real hard barriers between divisions. And that's really part of the effort. The other big effort is helping the community at large understand that the behavioral health needs that our divisions try and address are a part of the healthcare system, and we need to be better integrated with the rest of the healthcare system. To that end, it's a policy issue as to how do we convince or manipulate state policies so that integration with the rest of healthcare can occur, and kids with mental health or adults with mental health or addiction needs get treated just as anyone else would if they had another kind of condition like diabetes or heart disease or asthma. There shouldn't be a distinction between those things in terms of health, and there is. And rather than continuing in this fashion along the lines of specialty clinics and funding sources that limit what people can get, we need to move into this integrated healthcare system. And that's what I've been interested in working towards in the last 25 years. And here in Wisconsin, we're starting to see some of the seeds of that develop. And hopefully, within my lifetime, we'll get to a point where we see an integrated healthcare system where somebody goes to Dr. McGinnis or a physician and they just have a warm handoff to a behavioral health specialist who helps with those particular needs, and it's all coordinated. We all want to get there. I'm thankful that we have a staff, and Shar and Becky and Julie and everyone really that works here that want that same vision to happen, and we're going to get there. But for now, it's a matter of how can we best respond to the needs of our public. They're all doing that and doing it creatively, but I think we can move towards a vision where this department is operating more in a fashion where the public does not see the behind the scenes confusion and challenges that we face in doing that. So I just want to say that and thank Shar and Becky and Julie again for presenting tonight. Thank you.
Thank you.
And thank you, Bob. Great comments. Shar and Becky, keep up your great work as well. And with that, if it's all right with everybody, we'll move on to our last agenda item, which is an update on work being done with concerns in St. Croix County. Bob?
Yeah, thank you, Mr. Chair. I've been involved, and Julie has been involved in some recent efforts to address or to get involved in discussions around the immediate housing needs and how we as a department can contribute to resolving some of the housing needs or challenges that people in emergency housing situations have. We took part, Julie and I took part in I'll call it a task force that met on the 12th of January, just a week ago or so, that looked at that it originally was looking at motel vouchers and the motel voucher system for people in need of emergency housing. That sort of evolved into a broader discussion about how to not just coordinate the voucher system for motels, but more broadly to what kinds of things would be helpful to people in these situations, things like case management and care coordination, which seem to anecdotally it seem to have result in a better outcome for those people that are faced with emergency housing needs. And I know that Grace Place and West Cap are, to my knowledge anyway, are the key resources in our community for dealing with the housing issues and the broader challenges that we face, as Robin Thibodeau pointed out, around rent costs and housing costs and how they're prohibitive of people getting into housing oftentimes. I know those challenges are out there, but in this work group or this task force that Julie and I took part in, I think where we see a niche for Human Services is in the area of case management and care coordination and working with Grace Place and Westcap to coordinate efforts around helping people with documentation, helping people with getting to the next thing after that night in the motel. We have to do some internal discussion around resources and our ability to do that and how we're going to sustain it. But those aren't insurmountable kinds of problems. They're just things that we have to figure out and do it quickly in order to be of more assistance in those areas. Just quickly on the topic of motel vouchers, and I know Supervisor Ard could speak more to this than I probably can, but I know some of the challenges with that system is that when people are placed in a motel with a voucher, there's no mechanism for if there are damages to the motel room or other incidental costs, there's no mechanism to account for those charges or those damages other than to go to the organization that issued the voucher and say, hey, the room was damaged, we need money to repair it. That's one of the problems with vouchers. But again, with case management and other kinds of assistance, I think there would be a way to mitigate some of that risk to help people understand that there are the options available to them and that if there were mental health or addiction needs, that maybe an intervention could be planned with that person. I'm just talking. So there are many things that we could probably do. And I think my point is that we have an interest in doing what we can to assist in those areas. The other effort that I just recently became involved with was the West Central Homeless Coalition. Robin Thibodeau again invited me to take part in this. I know Duana from Grace Place was in this meeting with me, as were many others. And I'm still getting a feel for how that coalition, what kinds of things I could contribute or who I could delegate to contribute to that effort. I'll leave it at this. I think we recognize there's an immediate need for housing assistance to help to support Grace Place, to help and support Westcap, to do what we can to play a role in ensuring that people have a place to go and a place to sleep that's warm, where they're not going to freeze to death. All of those things are very important to me. It's not that I want to take forever to figure this out, but at the same time, I have to be mindful of what we have available to offer. And I'm trying to fit what we have or what we could think of that would help. I'm trying to fit that with the needs that are out there right now in a reasonable way, without being too cautious, but without being too overly eager either, and promising things that we can't provide. The eviction moratorium, I think, ends at the end of this month unless that's extended by the president. And that's the eviction crisis is looming for people affected by the pandemic and economically and otherwise. So there are many pressures on the system right now, and the urgency is there, the desire is there to do something about it. I hope some of that made sense. I'll be quiet and just see if there are any questions for me.
Any comments or questions? Paulette?
I have a question. And I'm glad you're taking this on. But was there any talk about warming shelters? You know, it used to be in our village, people went to the library. Maybe they lived in their car if they were homeless, but they could go to the library 9 to 7, or they could go to Walmart, which was 24/7, and those places aren't open anymore. Was there any talk about having those kind of places for at least them to get out of the cold for a while?
I'll try and answer that. I'm afraid I don't have a great answer. I had a discussion with Robin separate from these other meetings about that and asked, you know, what are some of the barriers to operating a warming shelter? There may be licensing or other zoning kinds of issues that play into that I'm just not as familiar with yet as intend to be. I don't know if Supervisor Ard has.
Yes, I can assist you with this. Warming shelters are just what the term says. They are only open for a limited amount of time, generally during the day. So persons may come in, depending on the setup of the shelter, they may offer a breakfast and possibly a lunch. There are other warming shelters which are only for the evening. So it is a large area which may have numerous bunk beds where persons are able to sleep overnight and then must leave during the day. The challenges that come in are, one, in finding and purchasing the space, insurance, staffing, payment of staff, as well as having a community that will embrace a warming shelter, or any shelter for that fact. New Richmond has been extraordinary and St. Croix County as a whole in supporting Grace Place and the work of the Salvation Army, as well as the Family House in River Falls. But this is not something that you see on a regular basis. So those are your challenges in a warming house. And it's very easy to see. We have a pit count that's going to be coming up here next week, in which we will have staff and volunteers who will be out in the field around midnight on probably a pretty cold night and trying to identify those persons who are in need of shelter. And we will find them in parking lots, in automobiles, in parks, under bridges, in fields, in culverts. Anywhere that you think no human being should ever be is where they will be found. And the numbers are growing. And I will tell you, I am still working. So as soon as I leave this meeting, I will be back to 50 cases that came in today of persons who are going to be facing eviction, whose utility bill is so high because they can't afford to pay it, or their rent is several months. The average is 4 to 5 months behind due to COVID. So we are looking at a significant situation in St. Croix, Polk, Pierce, essentially western Wisconsin. And I really have to emphasize that the sooner we could put a program together, especially in mental health management, the better it would be in partnering, because I'm speaking with people every day who have significant issues, and referring them to the county is, it's just not, it's not fast enough. So we need to be better, because we not only have a pandemic, we have a significant mental health crisis that's happening and is continuing to develop simply because of financial arrears and the loss of jobs.
Any other comments? All right, seeing none. Thank you, Scotty, and thank you, Bob, for your comments as well. Are there any requests for future item agendas? Seeing none. Bob, do you have any announcements or correspondence?
No, Mr. Chair, I don't.
Anyone else? Okay, I thank everybody for, it's been a long meeting, and we've had a lot of great information tonight from a couple of different areas in HHS. So thank you for your patience. Be safe. And our next meeting will be February 17th at 5 o'clock, and we will Zoom that meeting as well. Our meeting is adjourned. Thank you, everyone.